I'm Arsha Vahabzadeh at CES 2018 from the Digital Health Live studio, and I'm joined here by Bryan Adams, who is the Chief Commercial Officer at Great Call. Thank you very much for joining me.
Thanks for having me.
Now, you just had a really fantastic panel talking about some things that are very close to my heart, namely elder care, but also your use of technology at Great Call. Can you tell me what kind of developments have been happening?
Yeah, sure. At Great Call, we have a product called Lively Home where we install sensors in a senior's home. So something like a home security system, motion sensors, contact sensors, a sensor goes in the toilet, a sensor that goes in the bed, and we take all that information and analyze it, and we've been studying this problem for years, and we have some analytics that provide a little bit of a predictive analytic on that senior. So are they someone who might be at risk for losing their independence? And that allows caregivers of all stripes, a case manager at a health plan, to figure out what that senior needs before they show up in the hospital. A little extra home care, a med reconciliation, so that they can live happily, healthily, at home, independently.
It sounds like you've got quite a number of consumer subscribers already.
Yeah, that's right. The Great Call is the industry-leading brand for technology for seniors. We have close to 900,000 subscribers with our Jitterbug platform. We have the biggest smartphone. We have the industry-leading mobile PERS, and really the bringing that together with the analytics and the sensors to provide, for these seniors who are trying to keep them independent, the best experience for them, and then the highest quality care that they can be provided.
So I often hear a lot of people talking about data, but I think what I like from what you're saying is you're gleaming this data from lots of different sources and making actionable steps for a whole variety of different people and organizations and providers and health plans to be able to kind of improve the quality of life of many of these consumers and participants.
That's right. One of the keys to our solution is the passive nature. So we hang the sensors up, but then we tell the senior, you just live your life the way you've always been living it. And we collect that data. They don't have to do anything. They don't have to learn anything. They're not going to break it. And so they're engaged without necessarily asking for a change in behavior. And that data produces insights that says, hey, if I know that a senior normally sleeps 8 hours and now they're only sleeping 4 hours, I should probably call them and find out what's going on. And if it's a pain issue or if they're not feeling well, they don't feel like they can lay down, those are things that can be addressed in an outpatient setting, changing meds, and not with an ER role and a time in the hospital.
And all the cost and
that's right.
Life impact. What about the seniors? What has been their reaction to this technology coming into their home, their environment? What's their response been like?
Yeah, that's right. A lot of people assume, hey, isn't this really intrusive? And yet everyone has home security systems. And I think the way we talk to them about it is, it's like a smoke detector. You don't think you're going to need your smoke detector, but you would certainly never live in a house without one. And if we can just detect, when there's a little bit of smoke, we can help provide better care, and particularly for a generation of seniors who aren't necessarily likely to raise their hand when they need trouble, it just helps them feel better about the care they're getting. And the reaction we've gotten from them is, I think 94% of them feel like their health plan is helping them live a better life. So it's been a great response.
Bryan, that sounds a really incredible impact. Thank you very much for your time, and great work with Great Call.
Thank you. Thanks for having me.
So I'm Arsha Vahabzadeh, reporting from CES 2018 at the Digital Health Live studio, presented by United Healthcare. Thank you.